And this legacy is continuing for the past many years. Since we started this school in 1993, Dr. Mahbub Pir Sahab, Dr. Baladi Garu, Dr. Gauspir sir, Dr. Farooq sir, and many other doctors have been involved under Dr. Ramgopal sir. All these doctors are involved since very beginning, and unfortunately for the past 9 or 10 years we could not do it because our infrastructure was coming up, and we want to continue this legacy. And this program today is only limited to 7th class, LKG to 7th class. Actually, it is a pediatric oriented health camp, and mainly it is actually programmed after Dr. Gauspir Saab's advice that there are many cardio related cases nowadays, and it is better we identify such cases and do whatever is necessary. So in the recent general body meeting we had, he suggested that let us have at least a small camp where we can focus on cardio related problems. And let me tell you that in the past 4 to 5 cases in the same program, in such a program we detected some BSD cases like that, and we have helped the students also. Thank you so much.
Dr. Sir. Dr. Sirs, I feel it my grateful duty to invite you to Dr. Madams and workers. I feel it my duty, grateful duty, to thank you for having accepted our humble request and responded to our request to come over here. Just to give a brief glimpse of this school for some of the new doctors, Dr. Baladi, Dr. Mahbub, Dr. Gauspir, Dr. Farooq, all these people, they know about our school. But however, some of the new doctors, they don't know. You know, during the days of Dr. Manmohan Singh Sahab, Prime Minister, a committee was formed to assess the living conditions of the Muslim minority community in India. During those investigations, it was in our local Kadapa town, we came to know that there are 16 slum areas in Kadapa at that time. That is in 1993. They felt that Muslims are very backward in education, and we decided to start a school in a slum area to cater to the needs of the needy people. Those who can afford, they are going to the corporate schools. We wanted that education should be taken to the doorsteps of the needy people. We decided, and in 1993, we started the school with 60 candidates. By the grace of Allah, today we are having about 1200 students in our school. I am very proud to announce you that the results of our schools have been very encouraging. Last year, 100% success in 10th class from our school. And as far as the debating and elocution competitions are compared, our students have been participating. Some 7 or 8 years ago, our student got first and the governor gave the prize to her. This year also, one of our students has stood first, and she is going to Amravati to receive the award from the Chief Minister of Andhra Pradesh. We are giving you, but kindly extend your cooperation. Thanking you very much.
Ever since they have started the school from 1993, we used to do regularly medical checkups every year, particularly for students LKG, UKG, and first class like that. Every year we used to encounter at least 2 to 3 congenital heart disease cases. Some VSD, some PDS, some ASDs. Even I have seen children who are more than 10 years, which were being neglected. So early intervention is more important in some cases. And of course, other problems like dental, ENT, ophthalmic, everything. If you find out in the beginning itself, as we know, prevention is better than cure, something like
For the
that.
past probably 20 years. Earlier, every year they used to conduct this camp. Okay, one time there's a big camp, big medical camp, not only for the students, not only for the entire area. We even screened for tuberculosis. We taken MMR pictures. Tuberculosis also was excluded by taking MMR pictures, and it's a grand success. To our satisfaction also, we could recognize some of the patients who were tuberculosis patients and started an RATT. And many of the doctors have come there, and a total 24 total schedule, morning to evening. That also can be done if there is time and resources permits. And the other thing is, to start a school is very, very important. Imparting education is much more important than any gift. We can give food for one day. This is they learn to earn food. By education, we are giving a chance to earn food for their livelihood, to be good citizens, to be good people.
My greetings to all the doctors who are gathered here for the health camp to be conducted in Ayesha School for Children. It is really heartening to hear the words of founder president Mrs. Hazrath Ayesha about the starting the school, how it evaluated and how it gave a standard education to its poor students, and how it developed in all the sports and other activities, and it is in no way inferior to all the schools in Kadapa. I wish that it gives further good education and stand in good competition. And let me tell you, the Muslim community, especially all the communities in our India, were very backward in school education for children. More so with the children of Muslim community. Recognizing this fact, the committee of the school has given a thought to it, started the school with a good intention of at least give a section of Muslim community to the pure sections of the Muslim children.
చాలా కాలం నుంచి సుల్తాన్ మొహిద్దీన్ గారు వీళ్ళంతా నాకు తెలుసు, ఈ స్కూల్ గురించి కూడా తెలుసు. స్కూల్ సచార కమిటీ ప్రకారము చాలా వెనకబడ్డటువంటి మైనారిటీలో పూరెస్ట్ ఆఫ్ ది పూర్ పీపుల్ ఉన్నారు అని చెప్పేసి చాలా కాలం కిందటే వచ్చినది. ఇవన్నీ గవర్నమెంట్ చేయాల్సినటువంటి పనులు. గవర్నమెంట్కే ఎక్కువ యాక్సెసిబిలిటీ ఉంటుంది, ఎందుకంటే వాళ్ళ దగ్గరే ఫండ్స్ అన్నీ ఉంటాయి కాబట్టి. కానీ కొద్దిమంది టౌన్లో ఉన్నటువంటి వాళ్ళు పెద్దలు ఏదో ఒకటి చేద్దాము, హెల్ప్ చేద్దామన్న సదుద్దేశంతో ఈ ప్రాజెక్ట్ని స్టార్ట్ చేయటము, ఇంతవరకు విస్తరించడం అనేది చాలా గొప్ప విషయము. అందువల్ల వీళ్ళందరికీ మనసారా నేను అభినందిస్తున్నాను. ఈ ప్రోగ్రాంలో మేమందరం కూడాను మా వంతు సహకారం అందిస్తాం.